Hi, I'm David Tanaka. I'm a physician, an associate professor at the University of Colorado. I work at the Lowry Clinic. My father was a physician, and he was a very brilliant, hardworking, and humble person, and I've always tried to emulate him. He's been a very good role model. The majority of the patients I see are patients that I am their primary care provider, meaning they come to me for any and all medical questions, whether they have a complaint or it's follow-up for a disease. I think the other reason to see an internal medicine physician is if you have a problem that you need to be diagnosed. So if you have a condition that you don't know what's causing it, I think seeing a physician in internal medicine is an excellent place to start. My approach to patients really has been from the very start to listen to their problems and to try to understand how their problems are affecting their lives, to perform the necessary physical exam, which is probably not as important as listening, and then to try to formulate what I think is wrong, and then to discuss that plan with the patient and try to come up with what seems to be a good way to approach that. So it really centers around the patient and what they feel is going on and what's wrong. And then I'm trying to use that information and educate them about what I think is going on and try to come up with a plan that's acceptable to both of us. Some of my patients I've taken care of for more than 2 decades, and I really enjoy seeing those patients. I've worked with them for such a long time. I want to know how they're doing, what's going on with themselves and their families, and I think that is one of the most pleasurable aspects of my job is seeing some of my long-term patients. I still really enjoy seeing new patients and working with them and developing a new relationship in terms of a physician-patient. But I really enjoy seeing my older patients.